Senator Sanders.
Thank you, Mr. Chairman. I was interested in hearing concerns among some of our panelists about union roles in election. I didn't hear too much about the reality that one man, Mr. Musk, was able to spend $270 million to help elect Donald Trump president, and that billionaires are buying elections every day. Mr. Arnold, you and your coworkers, as I understand it, have been on strike for 80 days now. And as I hear it from you, Boeing has not come to the table with a serious offer. What does it say? How do your workers, your fellow workers, feel when Boeing could afford to pay its CEO, Mr. Ortberg, more than $18 million in compensation for just 4 months of work, as I understand it? $18 million for 4 months, but apparently they just don't have enough money to sit down with the union and negotiate a fair contract. What does that say to the workers at Boeing?
Thank you for your question, Senator Sanders. Well, it tells us that they don't value us. It tells us that they're seeking to maximize shareholder value by limiting inputs like wages for laborers. That's us. So we produce the value, but we don't get any piece of that value, or as little of a piece as they can allow to get by with.
Now, as I understand, you guys are producing some of the most sophisticated airplanes in the world, fighter planes in the world. Is that correct?
That's correct, Senator.
You got some really skilled workers doing enormously important work, right?
That's correct, Senator. And not only that, a lot of our members have to maintain security clearances, which is no small feat in and of itself.
All right, what has been the impact of this strike on workers at the plant?
Thank you again for your question, Senator. The impact on the workers on the plant is that they've had to go for 6 paychecks without any income. They've sought alternative jobs. Their health care has been cut off, so they've had to seek.
Say that again. I mean, you guys had decent health care under the previous contract, and Boeing did what?
They cut our health care off, sir. And when they cut our health care off, we had to find alternative means. So those who have spouses that work maybe were able to get on their spouse's care, but a lot of them had to pay $2,500 a month to get COBRA coverage, which is not very affordable when you're receiving $300 a week in strike dues or strike pay.
Okay, thank you very much, Mr. Arnold, for what you're doing. Ms. Turner, I have met, as the former chair and ranking member of this committee, met with nurses all over the country, literally from coast to coast. And what has impressed me is that nurses have come into my office with tears streaming down their eyes. And you know what they were in the office? So not to say we need more money. Yeah, they wanted better wages. They were there because they said, I'll never forget this. We were trained to do our jobs. We can't do our jobs. We don't have the staffing to do our jobs. It breaks our heart that we can't provide the quality service. Our people are suffering, patients suffering, sometimes dying. And we want help so that we can do our work. And I know that's a point you made. Am I missing something in that is the feeling of many nurses throughout this country?
Senator Sanders, you're absolutely right, that it is heartbreaking. We get, and it's not called burnout, okay? It's called moral distress. When nurses go home, and I feel especially for our young nurses who come out, and they come out with all these grandiose plans to be able to take care of their patients the best that they can, and then because of short staffing, workplace violence, just horrible working conditions, schedules that are not manageable, and they come away, especially when they have too many patients, they come away, they leave their day, they go into their parking lot crying their eyes out because they feel defeated. Okay, they feel like this is not what I signed up for. I wanted to make a difference in my patient's life, and I don't feel like I'm doing that. And just add that to the many reasons why nurses are leaving the bedside. Once again, we do not have a shortage. We are not treating our nurses right, and we need to start treating them right because they are the backbone of healthcare.
Ms. Turner, I know that the National Nurses United agrees with my position that healthcare is a human right.
Definitely.
That we need a Medicare for all single-payer system. My guess is that in your years of experience, you've encountered many patients who walked into the door who should have gotten health care months and months before. What do you think it will mean to this country when 15 million people are thrown off the health care they have because of Trump's massive cuts to Medicaid? What will that mean to healthcare in this country.
Senator Sanders, what that will mean, and I alluded to it in my opening statement, no preventive care, no managing their chronic diseases. And so what ends up happening is these people, how often has my story that I take from the emergency room said, patient found down, patient found collapsed in their home or whatever. Then they call 911, they bring them into the emergency room, and what do these do? Because they're in such poor shape, all body systems collapsing, they go to the ICU. Like I said, most expensive care. That's what's going to happen. They're not going to stop coming to the hospital, and furthermore, it's going to be uncompensated care.
Thank you very much.